This presentation shows the workflow for a medication refill process. The first demonstration depicts the workflow process for handling refills without a computerized order entry system. You'll see that the processes vary depending on information presented at the different decision points. You'll also notice that some of the processes involve numerous steps by many individuals. The second demonstration shows how the same workflow has been streamlined with the use of a computerized order entry system. As you watch these workflows, please follow along with the corresponding steps in the workflow diagrams. Decision point number 1. Are refills available? Yes. The pharmacy technician receives a medication refill request from a patient. She sees that the prescription has refills available, so she enters the refill information into the computer system. The pharmacy fills the prescription and the technician mails it to the patient. Let's go back to decision point number 1 and see what the workflow steps are when refills are not available. The pharmacy technician pulls up the patient's information on the computer and sees that there are no refills available. She lets the patient know that she'll need to contact his provider to authorize a refill. The pharmacy technician then completes a request form and faxes it to the provider's clinic. A front desk staff member picks up the fax and requests and receives the patient's chart. She delivers the chart to the nurse. The nurse then hands the chart to the physician for review and signature. Decision point number 2. Is the prescription authorized? Yes. The provider marks the prescription form appropriately, signs and returns the form and file to the nurse. The nurse faxes the prescription to the pharmacy and returns the chart to the front desk staff. The front desk staff then returns the patient chart to the file clerk to return to the file room. Let's go back to decision point number 2. Following is the process used when the prescription is not authorized by the provider. The provider documents the reason for declining the prescription request and returns the file to the nurse. The nurse then reviews the chart and calls the patient to explain why the prescription can't be refilled. She also documents the conversation in the patient's chart. The following demonstration shows a streamlined version of the medication refill workflow. Decision point number 1. Are refills available? Yes. This process, which uses a computerized order entry system, or CPOE, is very similar to the process that you just viewed, except that with CPOE, the pharmacy technician can receive a request via secure messaging in addition to phone or mail. After receiving the request, the technician logs into the electronic medical record, or EMR, sees that the prescription has refills available, and enters a refill request that is sent to the pharmacists. The prescription is then filled and mailed to the patient. Let's go back to decision point number 1 and look at the process followed when no refills are available. You can see how much more streamlined the process is using a computerized order entry system. The pharmacy staff sends a refill request to the provider using an electronic alert notification. Decision point number 2. Is the prescription authorized? Yes. The provider logs into the system and is alerted to the refill request. The provider then enters the renewal order electronically and signs the order. An electronic alert is sent to the pharmacists. Pharmacist fills the prescription and mails it to the patient. Going back to decision point number 2, this is the process followed when the provider does not authorize the refill. He documents the reason for declining the request and then sends an electronic alert to the nurse. The nurse logs into the EMR and sees the alert letting her know that the refill request was denied. She contacts the patient and explains the reason why his refill request was denied. Then she documents their conversation in the patient's electronic medical record.